Measles cases in Alberta have surged to their highest levels in decades, with 53 more confirmed cases today. The total tonight stands at 932. The province is urging people to get vaccinated, but unlike in many other provinces, you can't get that shot at pharmacies through public health. Instead, patients in Alberta have to go to a public health clinic. Pharmacists say that's just another barrier to getting more people vaccinated, and they're calling on the province to give them some help. That growing concern is prompting some parents to act quickly. Jacqueline Thorne is one of them. She recently got her 13-month-old daughter vaccinated. She joins us now from Calgary. And Jacqueline, so tell us, was there a moment or a headline that motivated you to act quickly and get your daughter vaccinated?
Not a specific headline, but definitely lots of headlines that were coming out. Growing cases in Alberta. She hadn't had any sort of measles vaccine yet, so we were definitely becoming a little bit concerned.
And what did it take? What was it like getting her appointment to get the vaccination?
Well, I called and asked. At the time, she was 10 months old, and typically the vaccine is given at 12 months. So I called and asked if we could get her in early and was told that they would not be able to do that unless we had a travel exemption. They were vaccinating people that were taking their kids out of the country. So I might have told a little bit of a white lie, got her in 10 months and they gave her a vaccine, no problem. And so she's had one, and we still have to give her her routine vaccination. So she's scheduled to get 2 more after this one.
I assume you're in touch with other mothers, other parents of young children. What are the conversations like, at least in your circles, when it comes to measles and the vaccine?
Parents are definitely concerned. I know parents of really, really young kids especially. I really feel for them. Parents of babies 2 or 3 weeks old right now. I think there's quite a level of concern for them going out in any sort of public place, especially indoors. So definitely a pretty high level of concern amongst my peers who have not been able to get their kids in yet.
Yeah, and why don't we leave it with this? What's your message for other parents out there in Alberta who up until now have not vaccinated their kids?
Talk to someone that you trust in the medical field. Ask them why vaccines are administered the way they are, why they're given at the ages they are, what things looked like before these vaccines were released. Get your information from credible sources that can really help you understand why it's important not only to protect your kids, but to help protect other people, immune-compromised people, elderly, these babies that haven't been vaccinated yet. It's important not just for you, but the wider community, that everyone understands how these work and why we get them.
Really well said, Jacqueline. Thank you very much for sharing your story and that message.
Of course. Thank you for having me.
Jacqueline Thorne is a mother who got her child vaccinated in the midst of this measles outbreak that is going on in Alberta. Okay, let's turn now to Dr. Lenora Saxinger, an infectious disease specialist at the University of Alberta. She joins us now from Edmonton. I know you're a mother as well. When you listen to cases like these, a mother's concern like this, what's your reaction, Dr. Saxinger?
Oh, I have immense sympathy for parents right now because they get a lot of exposure to, I think, really actively misleading disinformation about vaccines, and it can make it feel very hard to know what is right to do. Like, what everyone wants to protect their child, and it can be kind of unclear how best to do that based on everything that's coming at them. So it's a pretty tough time, I think, to be a parent.
Yeah, Jacqueline described her situation as using what she said, a little white lie, that her 10-month-old, I think at the time, wasn't traveling and so technically shouldn't have gotten the vaccination. I'm not going to ask you an ethical question, but a medical question. What benefit or what potential harm is there for a 10-month-old getting the first vaccination shot?
There's not really harm per se. The reason that the vaccine is given at 1 year of age, 12 months of age, and then a second dose later is actually because that's when the child is best able to make a good immune response to it. So it is safe to give children from age 6 months up, because by that point their immune system is mature enough to handle the vaccine, which is obviously a weakened virus. And the issue is, of course, if you have a dose before 1 year of age, it doesn't quite count towards the 2-dose total. It will provide some protection. It's a good thing to do if you're in an outbreak situation, but the child still has to get 2 doses after 12 months to count. So it's kind of an extra dose, really.
Yeah, and now all of that aside, for kids who are too young and that their parents feel are too young to get the vaccine, well under the age of 1. What should parents be doing, particularly in the areas of Alberta where we're seeing confirmed measles cases? What should parents be doing to protect their kids?
Well, I mean, this is quite a frightening disease because it's so intensely infectious that trying to limit exposure to larger groups of people in close quarters is kind of familiar from COVID, but that would be one way to limit risk. The other thing to do is actually be aware that even children who can't get vaccine can get immune globulin if they've been exposed to measles, and that can prove very, very useful for kids who otherwise might be at higher risk of severe outcomes. And so, not just saying, oh no, we've been exposed and then not doing anything, but following through and actually reporting exposure so that you might be able to see if the child or anyone else is eligible for either, immune globulin, which we would use for very small kids or immunocompromised people or pregnant women, or else for everyone else who would be vaccine eligible. A dose of vaccine early after exposure can provide significant protection against more severe disease as well. So there are things you can do, except then you have to know that you've been exposed.
Yeah, and so you know what? I think that bears repeating, Dr. Saxinger, so we only have less than a minute left, but for a parent of a young kid, too young to get the vaccination, how would they even know that their kid might be exposed, and how do they go about getting that shot?
Well, I mean, in some areas of Alberta, they're still reporting places where people with, active measles that spreadable has been. If you're in one of the zones where they've kind of given up on that, you would basically just have to be aware of what's going on in your network. And hopefully people will self-report to each other as well if there's been an exposure. And the best thing, of course, is as soon as you're eligible to get the measles doses as soon as possible.
Absolutely. Dr. Saxinger, always nice chatting with you. Thank you very much.
Thanks for having me.